From the studios of WWAY News Channel 3, this is your hometown show, Health Beat Edition, a program dedicated to health and medical issues from experts in the Cape Fear area.
Hello, and welcome to this special Health Beat edition of your hometown show. Today we're visiting with Dr. Jason Graf at Spinal Care of Wilmington. So if you have any tingling sensations in your hands and feet, burning or numbness, you're going to want to stay with us today because we are going to learn the causes and treatments for peripheral neuropathy. Dr. Graf, thank you so much for having us back. It's always a pleasure to be
Welcome.
here. Thank
Welcome
you.
back.
You are the author of this wonderful book, Peripheral Neuropathy. What do you do when you're out of options?
Yep.
Congratulations on that.
Yeah, thank you.
I really am hoping that we can learn a little bit today about what is peripheral neuropathy. I know so many people who have it, and what do you do when you're out of options?
Now, simply put, peripheral neuropathy just means there's a problem with the nerves that are in your hands and your feet, but really it's a lot more complex than that.
Okay, so really we're going to have to get in there and learn a little bit more about what causes and how you can treat it. So I think that we should go to your illustration that I know you have set up for us.
Sure.
So when we come back, we're going to learn the real in-depth meaning of peripheral neuropathy. For more information, you can contact Dr. Jason Graf. Spinal Care of Wilmington is located at 211 Racine Drive, Suite 202. You can call them at 910-798-5560 or go to their website, spinalcareofwilmington.com.
If you're interested in being a guest on HealthBeat, call 762-8581 or go to our website, wwaytv3.com.
Hello, and welcome back to this special Health Beat edition of your hometown show. We are here at Spinal Care of Wilmington with Dr. Jason Graf, and we are learning today about the causes and treatment for peripheral neuropathy. And wow, you weren't kidding. You have definitely created quite the illustration for us. But I must tell you, I tried to do some homework, and I tried to find out what it is and what are the causes. But the more I looked into it, the more I found that there is not one single cause. It gets very complicated. So I'm glad you've done this for us.
Quite complex. And like you were saying, there's never one cause of neuropathy. It's multiple causes every time. And that's what makes it so complex. See, when patients are having these symptoms in their feet, the problem is rarely in the foot. So that's why a lot of the treatments out there fail. If you're only looking at the foot and missing the other areas, the patient's going to continue to suffer. So that's why I've put this program together. It's a lot more comprehensive. So let's take those nerves in your feet. Okay, they start in your brain. That's where everything starts. So if you have a dysfunction in somewhere in the brain, through a domino effect, it can cause problems in your feet. So when patients come to see me, the first thing I always check is the brain. So let's talk about that first. One area I check is the parietal lobe. Now that's involved with the perception of external stimulus. For example, a patient coming in with a parietal lobe dysfunction, they may put their foot in the tub and they can't tell if it's warm water, cold water, hot water.
Interesting.
All right, so they'll look at symptoms like that. They may have like a rock in their shoe all day long, not even know it until at the end of the day they take their shoe off and their foot's bleeding and they didn't even realize they had a rock in their shoe. Sometimes I also see I might touch a person on their foot, a patient on their foot with neuropathy, and I'll say, okay, where did I just touch you? And if I touch their big toe, they might say, well, you touched me back on my heel.
Amazing. And
I've had patients say, you touched me on my other foot. And the perception is completely gone. So
again, we're talking neuropathy, so this is nerves, and people don't necessarily understand that that nerve in your foot is running all the way through the body, right up to the brain.
In the brain. So let's continue with the brain. So other areas I check is this pink area. That's called the cerebellum. And the cerebellum processes all of the sensations in your body. So for example, in your feet and in your hands, if that cerebellum starts to lose function or dysfunction, you'll get pins and needles, numbness and tingling. I've had patients come, sometimes they say, I've got ants crawling on my skin. Okay, some abnormal sensations. But also that cerebellum, it's very important in maintaining balance. So rarely does anybody check the cerebellum if you had a problem in your foot. So that's going to continue to get worse over time. It just doesn't miraculously get better on its own. So as that continues to worsen, now your balance starts to get off. That's very involved in maintaining a balance.
Okay, so balance is yet another issue that is related to
Yep.
peripheral neuropathy.
I would say 95% of the patients I see with neuropathy also have balance issues. And let's talk about that for a second, the balance, because that's very concerning. There's a study out from the Center for Disease Control.
Right.
They say of the senior citizens that they looked at, the #1 cause of death now is no longer stroke or heart disease or cancer, it's from falls.
Oh my.
And what causes you to fall? Balance problems.
Balance, right.
So when a patient comes and they say, hey, they have a balance problem, I'm looking at that cerebellum. And if I find a problem there, I have certain protocols that I do here in the office to help that and help that function at a higher level so their balance gets better, their feet get better.
Amazing.
Okay, so
Okay.
well, that's the brain. I look at other areas too,
Right.
but those are the main two areas I look at. So neurologically, the nerves in the spinal cord, we want to look at that. We also want to look at the nerves in the legs or in the arms, but today let's just talk about the leg.
Right.
You may have a muscular impingement of the nerve, and what that means is a muscle is tightening up, literally kind of pinching the nerve.
Right.
So you can imagine if something's squeezing the nerve, it's going to cause problems down the road and cause sensation problems in their feet.
Right.
And of
So
course,
is the sciatic nerve always a peripheral neuropathy issue, or just sometimes?
that's just one nerve.
Just one,
There's other
right.
nerves that could be involved. That's just like a main nerve that people are familiar with.
Very familiar. Very familiar.
Obviously, I check the nerves in the feet too.
Right.
So neurologically, these are things that can go wrong. Okay. Now, also, we want to talk about metabolically, internally, the physiology in the body. What else can cause these nerves to dysfunction? So neurologically, I like to check patients out, but we check them out metabolically as well.
So just when someone comes in for a consultation, and we haven't even finished with all the other things that you're doing, but it can be quite involved just in the analysis.
Right. That's right.
Okay.
So let's talk about the metabolic portion.
Okay.
Okay, so first thing I want to talk about statin drugs. Statin drugs are very effective at lowering cholesterol levels.
Okay.
They do a very good job at that. However, there are some major side effects to cholesterol. They can cause lots of neuropathy, and here's how.
Huh.
Even though they're lowering cholesterol, they're also lowering a substance called ubiquinone. Now, ubiquinone makes a substance called ATP. ATP is very vital for the energy of all the cells in your body.
Right.
So if your nerve cells are not able to produce ATP because of the statin drug, there's no energy to the nerve. And there are studies out there that say that statins reduce ATP by 40%. And
Wow,
patients
that's a large reduction.
yeah, and so 40%. Statin drugs, if a patient's been on it for 2 years, 3 years, 5 years, 8 years, imagine if you lost 40% of your energy for the last 8 years every single day. You're not going to feel good.
Right.
So when patients are on statin drugs, we need to talk about them about alternatives to lowering their cholesterol without the statin, get involved with their medical doctor and kind of co-treat them that way.
Right.
But also with statins, there's another problem. Besides the ATP production that it blocks, the protective coating on a nerve, okay, there's a protective coating, it's called the myelin sheath.
Right.
And for various reasons that can get eroded away and obviously cause nerve damage. But what statins do, they also prevent the rebuilding of that myelin sheath. So not only does it cause the nerve to die, it also prevents it from repairing. So it almost doesn't matter what I do
Right.
to fix the nerve if this is preventing it from getting better. Okay, so statins are a big issue with neuropathy. Another metabolic issue is, here's sugar,
Right.
diabetes. It's very well known, diabetic neuropathy, okay? Blood sugars can certainly cause neuropathies. And the way it does that is when glucose builds up in the blood, okay, the nerves, they're not insulin dependent. So what happens by osmosis, which means water draws the glucose into the actual nerve.
Right.
So what happens, think of the nerve like a big tube, like an inflatable balloon.
Right.
If you pump more air into it, the balloon swells.
Correct.
Same thing with the nerve. The nerve is going to swell up and literally crush the small fibers inside the nerve. So you can imagine if those small fibers are being crushed by those big glucose and water molecules, it's going to cause neuropathy symptoms.
Amazing.
Okay, so we have certain protocols in here that we help patients lower their blood sugar naturally. Okay, so we get involved with that.
Naturally. That's a very important word.
Without the medications.
Without the medications, because sometimes I think just, you know, because we're in pain, we're uncomfortable, and we're always looking for that quick fix. Yep. And it's going to lead us to drugs. But there are times when there are other natural alternatives. So,
certainly.
Okay, so keep going. Sorry.
Some other things I check. These are a bunch of vitamins, and there are vitamin deficiencies that are oftentimes overlooked. So, for example, vitamin B1, vitamin B6, vitamin B12, folate, or folic acid. Those, when they're deficient, they can cause neuropathy symptoms, numbness, tingling, burning. So that's something we also look at. Now, down at the bottom is your gut. There is something known as the gut-brain axis. And simply what that means, there's research out there that shows if there's inflammation or problem in the actual gut or intestinal tract, it'll cause inflammation in the brain. So when there's a problem there, we go back up to here, so maybe that inflammation sets into that parietal lobe, and again, that domino effect down those nerves causes neuropathy symptoms by inflammation in your intestinal tract, believe it or not. Okay, but there's something else in that gut. There's a phenomenon or a condition known as leaky gut syndrome.
Yes, I've heard of this.
And many times patients are unaware of this. They have no idea this is going on. What that does, when you have a leaky gut, it'll elicit an immune response and lead to what's called an autoimmunity. So down in this lower corner here says autoimmunity. What an autoimmune condition is, simply what that means is your immune system is literally attacking your own body tissues. So for neuropathy, your immune system can literally be attacking the nerves. That's a big problem.
That's a big problem.
So when patients come in and I do find an autoimmune condition, that takes precedence and priority over everything else. Because if I can't calm their immune system down, it doesn't matter what I do. So we got to get that under control first, and then we'll work on other things.
I see.
But you know, one of the things I really want you to understand, Grace, is neurologically there's a lot of things that can go wrong. Metabolically, there's a lot of things that can go wrong. And what happens, it's never one thing. It's never just the statins. It's never just the gut. It's never just the brain. It could be the statins, and you have a parietal lobe issue, and you have a problem down here with the nerve, and you have an autoimmune condition. It could be all of those. And if we're only addressing just one, all of these other issues are still going. That's why patients don't get better. That's why I've developed this program to look at all of the neurological components, all of the metabolic components, everything that can possibly go wrong. So when I know everything that's going wrong, I can have a comprehensive program that addresses every single issue.
That is amazing, and that is what we don't get. And I don't know what the reason is that our lives have become so complicated that we have things that, maybe 20, 30 years ago, we either didn't know what they were or we couldn't diagnose them. But certainly with something like this, oh my goodness, how do you get this? I mean, there are stories out there of people who've had peripheral neuropathy for years and years and years.
I see it all the time. I've had patients, we're going to talk to one in just a minute, she's had it for 15 years. And I worked with her for just 6 weeks. So she suffered for 15 years. And they overlooked some of this stuff. I mean, she had some back issues going on, but she also had an underlying autoimmune condition where I had to completely change up her diet. And within a matter of 6 weeks, her neuropathy's gone. She suffered for 15 years. So it's a matter of everybody out there's kind of overlooking all this other stuff.
Right. And peripheral neuropathy, I mean, from what I've seen just in people that I know, I mean, some people can just be uncomfortable, and then it can take a turn and be debilitating. Yeah,
it's a progressively worsening condition. It might start with a little tingle in your foot. Over time, now it's burning. Now it's coming up your leg. Now you're getting into your fingers and hands. It's going to progressively worsen until we find all these issues and take care of them.
So for people who are out there who are saying, well, I can kind of live with this, right? And there are those people out there. But now there's an opportunity to maybe begin to really research and find out what is the cause of this mere discomfort or this debilitating,
Right.
Annoying problem. Well, I think it's wonderful. I was very, very happy that you wrote this book, because I do have friends who have suffered with this kind of a thing.
I hope I simplified the complexity of it for you. I know you
Well,
looked
now I
online.
think that's an oxymoron to simplify the complexity. But suffice to say that you have taken a good approach of being able to show us the number of different problems that are involved. And again, not just one, not just another, but it could be a real complication.
It's always more than one.
Always more than one. Okay, so I think that you have a couple of patients lined up for us,
Yep.
who have some wonderful success stories to tell us about. So we're going to take a break, and when we come back, we will be with two patients who are great success stories of Dr. Graf's on their peripheral neuropathy. For more information, you can contact Dr. Jason Graf. Spinal Care of Wilmington is located at 211 Racine Drive, Suite 202. You can call them at 910-798-5560 or go to their website, spinalcareofwilmington.com.
If you want more information on today's Health Beat show or information on other Health Beat topics, visit our website at wwaytv3.com and click on Health Beat. Also, if you have a health-related question, email us at healthbeat@wwaytv3.com.
We're ready now to hear a few success stories on the care and treatment of peripheral neuropathy. Here with me now is Angela Zaccaro. Angela, welcome. Thank you so much for being with us today.
It's my pleasure to be here.
Well, basically, I need to hear your story. Tell me about your issues with peripheral neuropathy, how it started and how it's treated. Tell me about it.
I've had peripheral neuropathy for over 15 years.
Oh, my.
And when I was in Houston, I went to a neurologist, and they didn't find anything. And then when I came here, I went to a foot specialist, and he is the one who said I had peripheral neuropathy. And I said...
So your symptoms were basically in the feet?
In my feet, in both feet, and tingling.
Okay.
It's like pins and needles all through my feet. And I noticed it at night when all the distractions were gone, and you just zoom in on it, you know. So I went to this foot specialist, and he was going to give me Lyrica. And I said, well, what does that do? And he said, well, it numbs your feet. And I said, well, suppose you step on a nail. He says, well, you won't feel it. And I said, no, I don't want to do that. So I went to my regular doctor, and he said, it sounds as though it's coming from your sciatic nerve. He said, but how bad is it? He said, can you live with it? And I said, yeah, I think I can live with it. But it was very difficult.
And you say you had this for 15 years.
Oh, or more. And one day I got a magazine in the mail. It was called Health and Medicine. It was from Wilmington. And on the front it said peripheral neuropathy. Man, I read that and I said, whoa, my gosh. And that's how I found out about Dr. Graf. And I came to his office, and he took an x-ray of my spine. And at the base of it, it was deteriorating because he said it was arthritis. And I said, okay, you know, so what will we do? He said, well, we'll start on it. And I said, good.
But he knew that it was the peripheral
Well,
neuropathy.
yeah, I told him that it was. And then he did an examination and put pins into my feet to see if I felt it. And most of the time I didn't. So he said, but we'll get there.
So how long have you been under treatment with Dr. Graf?
I started right before Christmas and came 3 times a week. And I think now it's not all in my feet anymore, it's right in my toes. So I've made great progress.
Wow.
Yeah.
So that could be within 2 months?
Yeah. I had given up all hope. I'll tell you that.
And how often do you come for your treatments?
3 times a week.
And that's fabulous. So
Yeah.
it doesn't keep you up at night, and
No,
It's
well,
far less.
yes, I know it's there, but I can go to sleep. And it's a wonderful feeling.
Well, when you've struggled with something for 15 years
Yeah.
and you see that kind of relief, that's really wonderful.
Yeah, I think so too.
So you still have a little bit more time to finish your treatment, is
Yes.
that right?
He said I would have to come maybe once a month until it's completely gone.
I see. So the treatments were a little bit more frequent at the beginning of the treatment, and as you're getting better, it's a little further apart.
Right. And part of the treatment was spinal decompression, and that was part of it. And he put me on a diet, and apparently I can't eat anything with wheat in it.
Oh, okay. So you've got that going on
Yeah.
too. Well, again, it points out that when peripheral neuropathy is part of the problem, that there can be many, many different causes. So it's
Right.
not just from one thing. So there could, the treatment options are many.
Yes.
Well, that's wonderful. I think that's a fabulous success story, though, that within this short, barely 2-month period, you're seeing such tremendous results after living with this for 15 years.
Yes.
So thank you so much for sharing your story with
You're
us
welcome.
today. I'm very, very happy. I'm very happy for you.
Thank you so much.
Thank you for being here. That was a wonderful story from Angela Zaccaro. Now we're going to hear from Mr. Bill Schwartz and learn of his experiences with peripheral neuropathy. Bill, welcome, and thank you so much for being with us here today.
Sure, my pleasure.
So really, because it's peripheral neuropathy can be so different, tell us your story. How did you get this, and what has your treatment been like?
Well, I don't really know how I got it, but I've always had an active lifestyle, doing sports and doing landscaping for a living. And it started showing up in my feet. I noticed my feet would be extremely tired at the end of the day when they hadn't been previously. And then it started showing up at night when I'd be sleeping, twitching. And again, I sort of blew it off at first. But when it became problematic to where I couldn't sleep, I went to my medical doctor. And he, of course, did what he thought was correct, and it didn't fix it. And he sent me to a podiatrist. And he consequently fitted me with different soles, different shoes, different items that he had. And I actually went to a neurologist then, and he did the medication, I should say, and that didn't work well with my lifestyle at all, and it really wasn't curing it. When I had pain medicine, I was fine. When it wore off, then it was back to the bad news.
Right.
So I found this alternative to them guys. I found Dr. Graf on the internet, actually. And, you know, admittedly, I kind of came here as a last resort.
I see.
I hate to say that, but it was. And I trusted him, and I followed his therapy. And I've been finished at least a year now. And I'm thinking it was a 6-week program that I went through treatment plan. And I've not had any problems since then. So
Amazing. So how long would you say you had the problem in the first place?
prior to coming here,
Prior to coming here.
I would say through all that, at least a year. I battled it with other ways that didn't work.
And then in a 6-week session with the different protocols that he might have given you.
Right.
And are you free?
And I'm free. I don't, I have no need for any of his sessions that we had. I watch what I do a little closer, maybe, you know, as you do when you get older.
Yes.
But but no, it's cured me, and I've had no consequences since then, other than I've got a freer lifestyle. I can walk again. I go to the gym. I still am active in landscaping. Take my wife dancing occasionally.
Oh, wow. If peripheral neuropathy treatment will help people get back on the dance floor, that's really great.
It has. It's been a lifesaver.
So it was starting to affect your general lifestyle.
Absolutely, yeah. It just degrades it slowly. And you notice things you can't do, and you kind of hope it'll come back around, and it just didn't for me. I was at wit's end when I came here, and like I said, I put all my confidence in Dr. Graf and his program and his treatment, And it was great for me.
Well, definitely not misplaced confidence, that's for sure. And because peripheral neuropathy can be so complicated, it doesn't have just one particular cause, nor does it have one particular treatment. So you could be talking to a lot of doctors a lot of time until you get to the root and solution. And you found the right guy. Well, I am so happy for you. I'm very pleased. I'm glad you're back out on the dance floor.
Oh, yeah. So's my wife.
Very good. Well, thank you so much, Bill. It was a real pleasure.
My pleasure,
and,
Grace.
Another great success story.
Absolutely.
That's great. Thank you.
Thankful to Dr. Graf.
For more information, you can contact Dr. Jason Graf. Spinal Care of Wilmington is located at 211 Racine Drive, Suite 202. You can call them at 910-798-5560 or go to their website, spinalcareofwilmington.com.
If you're interested in being a guest on HealthBeat, call 762-8581 or go to our website, wwaytv3.com.
Wow, peripheral neuropathy be gone. That was absolutely amazing, listening to those two wonderful people talk about how you've helped them so much. You do walk on water, don't you?
Well, I try, but you know, like Angela, you've been suffering for 15 years. I take it away in just 6 weeks. That's pretty remarkable.
That is remarkable. Anything else that you'd like to add? I mean, the best advertising is happy, successful patients, but...
Sure. Well, like we said, there's millions of people out there suffering with neuropathy, all these symptoms in their feet, and just simply give me a call. We need to find all of these causes. What can possibly be going wrong with your feet?
Right.
And once I know what's wrong, we can help you.
Okay. Well, that says it all, everyone. So if you or a loved one are suffering with any of those annoying symptoms or, you know, just trying to live with it, don't. Absolutely come in, visit with Dr. Graf. He will do the in-depth analysis and you too can feel better. So thank you so much, Dr. Graf. It's always a pleasure to come here and it's always an education. Come on in and see Dr. Graf. You will not be disappointed. For more information, you can contact Dr. Jason Graf. Spinal Care of Wilmington is located at 211 Racine Drive, Suite 202. You can call them at 910-798-5560 or go to their website, spinalcareofwilmington.com.